Okay, we're live in Long Island at Martial Arts, and we're going to be showing you how to do CPR on your dog. How's it going today?
Doing good. We're ready. Ready to teach some CPR to some people. I'm Dr. DQ, and this is my assistant Saber. He's been doing this with me for quite a while, so he knows the routine. Um, and I've been an emergency vet for 18 years, so I feel like this is really important because a lot of times one of the hardest parts of the job is when people leave their home, their animal's sick, and they get to the vet and they pass away and they didn't know what to do with the disease. So this is a skill everybody should know how to do. Um, and it is a simple skill, but you just have to first learn how to do it. Now, if your dog needs CPR, how do you know that? Well, the first thing you need to know is how to take a heart rate, how to take a pulse, and how to take a respiratory rate or a breathing rate. So I'm going to show you that now with our friend Saber and kind of get you used to that. So first is a heart rate. Saber, stand now. So where you're going to take a heart rate is right on the side of the chest. If you pick up their foot where the point of the elbow meets the chest, if you put your hand right there on your dog, you'll feel the heartbeat. If you can't, kind of shift your hand around until you kind of feel it, but it's in that area. And what is the heart rate? A normal heart rate for a dog is 100 to 130. Some dogs are a little lower at 80, some are a little higher at 140, but that's the general range. And how you measure that is you use your watch or a stopwatch for 15 seconds and you count how many beats you feel in those 15 seconds and you times it by 4. If you can't feel a heart rate, some dogs like Rottweilers that are deep-chested can't really feel their heart through their chest, they're going to do a pulse. Sit down, sit down, please. On people, you feel the pulse here or on the wrist. On the dog, you feel it in their groin area. It's called the femoral pulse. And it's right where the body wall meets the leg on the inside. So you don't put your hand on the body wall, you put it on the leg. And you kind of like roll around and you'll feel a dip and then you'll feel the pulse. Sometimes it's a little easier standing. Face up, face up. If you bring your hand down the side to meet the leg and then just curl your fingers in to the inside of the leg, you'll feel the pulse. And it should be the same thing, 100 to 130. Have a timer for 15 seconds, times that number by 4, and you'll know what the normal heart rate is. Down, please. Now for respiratory rate of breathing, you're going to look at their chest. And you'll see it rise and fall. Now he's fuzzy, so that's a little tough. If you look right in this area, you can see it kind of rising and falling. Or you can put your hand on their chest and feel it rising and falling. You can also put your hand in front of their nose, but what mostly happens is they start sniffing your hand, so it's not really a respiratory rate. Obviously, fuzzy dogs are a little more difficult. If your dog has a very short hair coat, you can see that quite limited. So, knowing that, when do you do CPR? You do CPR when there is no breathing and no heartbeats. And that could be your dog running toward you and they just collapse and you don't know what happened. So you run over and that's what you're going to check first. A very common situation which you may find yourself in needing to do CPR is a choking situation. So you're playing with a ball. I'm playing with Saber with the ball and the ball goes down his throat and now he's choking. So I have to do the Heimlich maneuver, which if you've done for a human, is very, very similar. It's where the rib cage comes up into a V. Right below that V, you put sharp upward pressure, and whatever the choking is going to come in. So when the dog upsaves, it's in the same location, right where the rib cage kind of comes together, right here, and you'll feel a soft little spot there. And you should find it on your own dog so you know. Now, yes. So if you have a big dog, you're probably going to do the Heimlich maneuver with their back legs on the floor, and maybe they have their feet up on a chair. With Saber, I'm probably just going to lift him up myself and kind of brace him with my legs. And then if you have a small dog, they're going to be probably all the way like this. And what you do is you just put your hands in that location. I know, Saves. I know. And you thrust up until you get something out. Now, if you get whatever is lodged in their throat out, Saber, come here, and they're doing fine, you should probably still see the vet and make sure everything's okay. But if they're collapsed, you're going to want to check. Now, I check Saber. I don't feel a heartbeat. I don't feel a pulse. Oh no, oh no. Then I look, he's not breathing. So now I have to do CPR because he had whatever was lodged in his throat in there too long. Actually, 3 minutes of no oxygen to the brain does irreparable damage, excuse me. So this is a quick process that's going on here. So CPR is like in humans, if you've done a human course, ABCs, airway, breathing, and circulation compression. So the first thing you do is check their airway. Now I just did the Heimlich, a Super Bowl came out, but there could be something else. So I just open his mouth and I do a finger sweep. Now your dog's not going to give you a hard time because they're going to be collapsed and not responsive, but Saber's tolerant of me. And then I'm going to give a breath. And in a dog Saber's size, I'm going to put my mouth over his nose and hold his mouth shut. But in a smaller dog, you're going to put your mouth over the nose and the mouth. And then we're going to give a breath. So I grab him and I blow. Now, obviously, again, the air came out. I'm going to demonstrate that on the mannequin dog as well. So I gave the breath, the chest rose, I know it's a clear airway, and now I go for my compressions. And you're going to do the same landmark. The elbow up, where the elbow meets the chest, is where you're going to put one hand over the other hand and do your compressions. Now, you don't want to be leaning back and doing it. You want to be right over the top of the dog. You don't want to bend your elbows like this. That's not going to work. You want to keep your elbows straight and locked, and you're going to push 15 times. All right? And then you're going to give another breath. And then you're going to repeat. And you're going to keep doing this for 20 minutes. Hopefully you don't have to do it for 20 minutes. Hopefully your dog comes around before then. If you have somebody with you, they can be getting the car so that you can be doing CPR and get the dog in the car and continue CPR until you get to the vet clinic. 20 minutes, if you've done CPR for 20 minutes and you have no response and the pupils are dilated and their body is getting cold and they relax, and then unfortunately CPR has not been a success. But hopefully that's not the case and you're in the car going to the emergency clinic. Now I'm just going to show on my mannequin, Saber go, two things. One is, how hard do you compress? And that's probably 30 to 40% of the chest wall. So if you watch me on the mannequin, I'm not going all the way down. It's a good pressured compression. Don't worry about breaking ribs. In 18 years, I've never broken any ribs as hard as I've gone. And it's better to err on the side of harder because you have to compress the heart in order to circulate the blood. And as you heard when I did this, even when I'm doing the compressions, air is going in and out of the lungs. So that's why doing a breath every 15 seconds is not a big deal. And I want to show you on the mannequin also how the chest will ride when you blow into the nose. So you'll see that, and that'll tell you that you have a clear airway. In terms of CPR, that's pretty much it. I think the key is to remember that it's a simple technique, because in the situation that you find yourself doing it in is usually highly emotional. Your dog is not responding, and you just have to take a breath and remind yourself that this is a simple technique and I can get this done. I can do this. And hopefully you're successful at least at giving it or getting your dog to the vet where they can get specific treatment.
Cool. Well, thanks so much for showing us that really important information.
Very welcome.
We will post a link to Martial Arts in the top comment. And you mentioned that you'll be answering questions later on?
Yeah, I'll keep checking the comments, and if anyone has any questions, I'm more than happy to answer them. I'm sure there's a lot, because this is just a small bit of everything that you should know in order to keep your dog safe. So I'm more than happy to answer questions.
All right, we'll post your questions in the comments, and she will hopefully answer them later on today. Thanks for watching, everyone.